the hospital following a serious auto accident. Diagnosed with punctured lungs and a head injury, the person wound up being 2 weeks in the ICU, and after those 2 weeks, he returned to the floor with a tracheotomy. Has anybody worked with a patient with a trach?
Mm-hmm.
Okay, so you know what can happen with a tracheotomy, right? Awesome. Okay. While he required frequent suctioning to maintain his airway. Now, once he was on the floor, and I don't mean floor, I mean on the floor of the facility, the patient's condition deteriorated. When first seen by the staff nurse, the patient's respirations, heart rate, blood pressure, and temperature were elevated. The physician was called, medications were ordered, and an order was given for suctioning and monitoring until the physician arrived, so to maintain that process. The nurse suctioned the trachea, gave the medication, then left the room to attend to other patients. While alone, the patient's trach began to flop, and he used the pulse valve to summon assistance. After 15 to 20 minutes, he began to choke and fell from the bed. He was found on the floor, now this time I do mean the floor, and he was unconscious and in his own feces and urine. Large amounts of mucus were suctioned from his trach. He was returned to the ICU, and now he had a hip fracture that was diagnosed from the fall. The patient required a total hip replacement. Okay, so now what I want to ask you is, did the nurse have a duty to the patient? Yes. Was there a breach of that duty? Yes. Is there a causal connection between the breach of that duty and harm? Yes. And were there any damages to the patient? Yes. Do they have a case of malpractice? Yes, they do. So that patient, patient's family, patient's representative, any person representing the patient so opts to prove, this would be a case where they would be able to possibly prove malpractice. Let's see what the outcome was. You want to hear what happened?
No.
Okay, let's see what you decide. The charge was failure to properly monitor. Did this nurse properly monitor that patient? No. Okay. You want to hear what the settlement was? $1.66 million was the verdict for that. It gets worse if it's a bad baby case, I can tell you that. Okay, let's go to case. Risk management tips on this one. What you wanted to do here is refine your knowledge of the care and monitoring of trach patients. If whatever your area is that you're working in, you want to make sure you are totally up to date on the latest procedures and processes that are associated with taking care of those types of patients. Utilization of monitoring equipment, keep up with that. Utilization of additional personnel to help monitor the patient. If you have to leave a room for a reason and someone has to be closely monitored, you need to get somebody else to take your spot to make sure that you're not doing your duty as a nurse. Recognize that a newly transferred ICU patient with a trach would require frequent monitoring and suctioning to prevent injury. Communicate with other personnel or supervisor that the nurse had to remain with this patient. Excuse me. And additional help was needed to care for the other patients. Perform continuing education regarding the care of trach patients if this is something that you're going to be doing a lot of. Case 2. Let's talk about this one. This one's a medication error. This is a male patient also. I don't know. I think these guys are sick. I don't know what to say. 2 males in a row. But a male patient diagnosed with cancer arrives at a cancer clinic. Anybody working in oncology? Yeah? You? Okay. And any rotations yet in oncology? No. It's a whole other experience. The male patient was diagnosed with cancer. He comes in seeking for a higher pain medication, higher dose of pain medication. Really was feeling very bad. The nurse asked several physicians to see the patient because the patient is in a great deal of pain. Each physician states that he or she will not see an extra patient in their schedule that day. They're already swamped. Finally, an oncologist agrees to write the patient a prescription for a higher dose of morphine without seeing the patient or the patient's chart. How's that sound? It sounds stupid, right? Not so hot, that's right. And so if you find a physician who's willing to do something that's outside their scope of practice, what they should be doing, and you are aware of it, what do? You tell them, that's the first thing. And what if they don't listen? What? I'm sorry? CYA, I heard somebody say. What else? Document and elevate. Go up the chain of command if need be. So this person was a higher dose of morphine. So the nurse tells the oncologist, doctor, this dose is too high. It's really not safe. So the nurse knew. And the nurse is told that the dose is too high and to give the script to the patient anyway. The nurse gives the patient patient and the patient's family that she will call the patient to see how he is doing, and the patient leaves. Okay? So now, here's the nurse who's following an order, concerned about it, expressed her concern about it, and what we don't know yet is whether she documented it clearly, and what happens? The patient dies 48 hours later. These are live true cases, by the way. The autopsy shows an overdose of morphine slowed the patient's respiration to the point of death. The physicians in the cancer clinic attempted to blame the death on the nurse. Now, here's an instance where the facility was sued, the doctor was sued, the nurse was sued. The nurse, who had expressed that she was concerned about this and had documented it, as you'll see in a minute, which helped her ultimately, but it was the physician at the facility who turned it against the nurse. Rather than that, they tried to blame her, stating that the nurse should have known not only that the dose was too high for the patient, but should have taken it further, because she should have realized how busy everybody was. So with that being said, did the nurse have a duty to the patient? Yes. Was there a breach of that duty? Yes. Is there a causal connection between the breach of duty and harm? Yes, and certainly there were damages beyond repair. All right? In that case, what happened here? Charge was medication error. Action, charge was dismissed for the nurse. Now there's some outcomes I'd like to share with you on that. The nurse had properly documented everything in the patient's medical records. The patient's signs and symptoms, the physician's refusal to see the patient, the nurse's concerns about the high dose of morphine, and the times the RN called the patient. All of that was documented. Her documentation was excellent, and as a result of it, the nurse got dismissed from the lawsuit. We represented her. So I can tell you, your documentation can work for you. It could also work against you if you hadn't done all that. But then what could she have had as her defense in that situation? So it worked for her. Now, I will tell you, she still needed to do some other things because she should have elevated that situation. But she did have clear signs that she tried to take action, and the lawyer used it. So she did not get charged anything. Her case was dismissed. Yes.
On the first paragraph, are you meaning that she called the patient or called the doctor?
She followed up actually with the patient. She did follow-up. She chose to do follow-ups with the patient because she was still concerned. And as she was hearing things, I mean, I think at that point she started to involve her management in the process. She should have elevated it sooner. That's what she should have done. But that being said, because of everything else going well, it worked in her favor. Follow through is important. I'm not going to read all this to you. Be a patient advocate. You are there for the patient. You are their advocate. Some people who come with those patients, they can't speak for themselves. Even some people with language barriers, literacy issues. There's so many things out there. They need someone to be their advocate, and basically, when you establish that duty in part, you're it. So you need to think that way. And I always try to look at people as, you know, if that's my mom or if that's my relative, or, you know, how would I want them to be treated? And then you need to report. If you are in a situation that's beyond your scope or puts you in a vulnerable or horrible position, you need to elevate, report, and document. Okay? Case 3, I'm going to go through another. I think we have enough time for this. I do have 4 cases, but I'll go through at least this one. And if we don't get through the 4th case, what I'll do, we're going to post this on our website, this presentation. So we'll tell you where it is, and if you wanted to go in and look at the 4th case, you could do that. But we'll see what time we have. Because do you have a hard stop at 4:30? 3:30? 4:30. That would have been cute, huh? Another hour.
Probably go in a few minutes.
You could go a few minutes.
5 minutes.
Over, you probably could. Okay, I don't want to keep anybody. All right, communication. There's danger in communication or the lack thereof. Here's a case where we have a female patient who learned she was pregnant. The patient was at risk of becoming infected with CMV. I would say the word, but you don't want me to do it. It just would not be exactly correct. I keep putting the emphasis on the wrong syllable, so forgive me for that. Which can cause severe birth defects. Are you all familiar with CMV? It's a form of herpes type thing? Okay. Patient and her husband agreed to abort the pregnancy if the test showed that she had CMV. The physician tested her for CMV and instructed the nurse to notify the patient of the test results. The test results were positive. The nurse incorrectly told the patient that positive results was a good thing, and it indicated that she did not have the infection. She read it wrong, and she thought positive meant in that particular case. And something positive does mean good, but in this case, positive was not good, and she read it wrong. Based on this information, the patient and her husband decided not to abort the pregnancy. The child was born with CMV-induced birth defects, such as nystagmus, microcephaly, mental retardation, developmental delays. Do you know what microcephaly is? A tiny head? Okay. Mental retardation, developmental delays, loss of fine and gross motor skills, and hearing loss. Did the nurse have a duty to the patient? Yes. Was there a breach of that duty? Yes. And is there a causal connection between the breach of duty and harm? Yes. And were there damages to the patient? Yes. To the patient's family, to everyone, there were severe damages. In this case, you can decide again, the charge was communication error. What do you think happened? One person, if you could give me one of these so I could hear you. Big money. Big money. And what do you consider big money?
No whammies.
Several million? More like 3 years. Well, that's going a little far. If that happened, I think we'd all be out of business. If the action was over $3 million. And that's with negotiation, doing everything you can to keep the cost down. $3 million. Because again, you have a long-term effect with that patient. Okay? So make sure all communications are accurate, timely, and appropriate. That's not only the ones you're giving, it's the ones you're getting. Make sure you're clear about what you're hearing and what you're seeing and what you're reading. Know and follow the chain of command. Again, if you saw positive results or you had any question about something, say, well, what exactly does this mean? Make sure you check it out before you communicate. And needs to ensure that timely and appropriate nursing and medical care is being given in this instance. Maintain clinical nursing competencies and continuing education. That's very important. Some people enter professions where they learn it and they go out the rest of their life and they don't learn anything more about it. So you can either be a person who does a job or you can be a person who has a career and a person who really focuses on continual learning because you happen to be in a profession that is changing every day. You're choosing a profession that offers you multitudes of opportunities and it changes every single day in the medical profession. I mean, where they don't have a study for cancer patients today, they might have a new study tomorrow. So you really need to keep up with what you're doing. Obtain additional education wherever you can. Yes, ma'am?
Why was there no follow-up appointment after the doctor knew the results and knew that they were decided to abort, and then they decided not to abort? Wouldn't you think that would be a little awkward and not right?
Well, I don't. Should a doctor do that? My personal opinion is yes, but if you go to a physician, I want to know how many people go to a physician and you're really sick, and how many of them call you to follow up what's going on after the doctor.
I think that with all the appointments that they have to follow up with anyway with pregnancy, you think that would have been discovered earlier?
Well, you would, but you would have thought that, but it wasn't because the test showed, and they thought they had it tested that she was fine. And I don't think they discovered that too well into the pregnancy, and there comes a point where you can't abort. So, I mean, I'm not sure exactly where in the pregnancy cycle they became aware that the results were not communicated properly. And there's a good chance that the physician that they had the test done with is not the physician they went through as their OBGYN. So I'd have to read more of that particular case to answer those questions specifically. But I can tell you that somewhere along the line, they became aware that what that has been communicated to them was the exact opposite of the real fact. And so that's where they came up with their dilemma. So, yes.
I would think, I'm not sure, but if something like this happened, I probably would be working for the facility anymore. How hard would it be for me to find another job once you go through something like that?
Well, I have to tell you, that varies. There are times you go to very difficult times on another job. And there is a nurse database. And a lot of things that are recorded. Once an indemnity, once the charge is settled against you, it does get entered into the nurse's database. And as a result of that, does follow you for a period of time. Although I can tell you from our insurance perspective that if we are the nurse's advocate, you are the patient's advocate, we are the nurse's advocate. So if we have a situation where a nurse applies for our insurance, for example, who's already had a chargeable incident, depending on the terms and how recent it was, if there's been multiple incidences or one incident, I mean, a lot of people can be charged. An angry patient can charge you. That doesn't mean you were wrong. And so we try to get to the bottom of it and understand what happened there, and often we'll do what we call an underwriting referral. We will refer to the underwriting company and explain to them the circumstances here. ask for any copies of documentation, and be the advocate for the nurse with insurance. That's one example. For employment, I can't speak to that because each employing facility may look at that differently, and I can't be their voice for that.
And then they obligated to share that with the facility.
Well, most applications for insurance and most job applications will ask you if you've ever been involved in a case. And you have to be truthful. I'll tell you why you have to be truthful, no matter what that means. Because if it's found out that you haven't been, your license can be revoked. And you can lose your job anyway. So it's a very delicate situation. Truth and honesty is your best friend at that point. And then explain what occurred and keep documentation of what occurred. Yes?
Correct me if I'm wrong, but isn't it the physician's realm of duty to go over an initial lab result?
In a lot of cases, yes, it is. And you can but sometimes it depends on what state you're in. This is where your State Practice Act comes into place. All of you sitting in here are from different states. And your State Practice Act can have different nuances to it that are different than another state. So if you're a nurse who lives in Montana and works in, oh gosh, geography is my worst subject. Wyoming. Thank you. If you're right by the border and you go right across the line, you run into it. You need to know what the Practice Act is for where your license is in Montana. But you also need to understand what the laws are in Wyoming, because you need to understand that to see what you could be held to in that state. No different than if you drive your car from one state to another, you're held to the laws within that state. Now your license is from one state, and you have to follow the laws of that license that you've been issued. But as soon as you drive into another state, you have to be aware of what's going on in that state. I can't ignore those laws and say I'm from Pennsylvania. There isn't any officer who's going to want to do that, right? So you have to be aware. Knowledge is power. Knowledge helps you. It protects you. So let me keep moving on. I'm going to skip failure to document. I'm not going to really go look. Okay. And the outcome, in case you want to look it up on the website. Documentation, we've covered all this. I'm not going to spend time on it. Also, a couple more risk management recommendations. Promptly notify, clearly and consistently document, utilize the chain of command, and always document the details. I keep repeating these because they're that important. Not because we don't know what to say next. They're that important. Yes?
Well, the documentation, of course, we're talking about our facilities documentation, but we all have our little brains that we play with.
Hold on a second. Can you all hear her?
No. Well,
Gina. And let them have it.
Well, it's just a little.
Okay.
So we have documentation in our facility. If you don't document, it hasn't happened. But we also have our little brains that we keep in our pocket. And my question is, have you run into where they do have, not patient information, like personal information, but do they keep their own notes to help refer to it? Does that help at all?
Nurses' notes, it needs to become part of the medical record. Because legally, that's all they typically subpoena. So if that gets put into the medical record, your notes, then yes, it would be part of what would be subpoenaed. If not, I don't know when you made up those notes. I don't know. It may not look to me like it's
Always put in the shutter box.
and I can't run that risk and pulling that in. So you want to make sure that the right things are in the medical record. That can serve as your friend. I'm telling you, if you do it right, it can serve as your friend. So you want to be careful about that. And here's another thing. We could spend 3 hours here. Don't think I'm going to lock the doors. I just go over things with documentation. There is so much that needs to be covered over that. I have often done talks on that and do modules on documentation because it's that important. All right, 10 steps to prevent lawsuits. Defend the patient, stay current, use the entire nursing process, document thoroughly, audit your nursing records before you go home to make sure everything's been done, use what you know, delegate patient care wisely, know your State Practice Act, review it at least once a year, know your department's policy, review them at least once a year, if not more often, show kindness and respect. I'm obligated to put a disclaimer up here. You can read it at your leisure on our website. I'm not going to go through it. These are some of the sources that we use, including the CNA claims study at the end. They're not the only sources. This will also be on the website. And then I wanted to talk to you real quickly about the 10 things that distinguish a good nurse from a great nurse. Does anyone know what they are? You can be a good nurse by being a good clinician and being very good at what you do. But there's only a certain way, I think, that you can be a great nurse. This is taken from an article that I read a long time ago. Janet Abdenauer published this in RN Magazine. Have you heard of RN Magazine? And I've always kept this, and I like to close with it, because I really think it very much encompasses to me what makes the difference between what is a good nurse, a good clinician, good person who follows all the rules and regs, does all the things they're supposed to, and what distinguishes you as a great nurse. So I'm going to share this with you. It goes without saying that you should be clinically competent. It's your action and attitude during the day that sets you apart from the crowd. So here are 10 talents for you to consider as you go into enter the nursing profession. They are actions and attitudes that come from the heart. Remember, according to Aristotle, excellence is not an act, but a habit. The first distinguishing factor that I see is compassion. Compassion is defined as the ability to emit a warm, honest concern about someone else's well-being. The second is empathy. Empathy, as being able to put yourself in someone else's shoes, goes hand in hand with compassion. Simple things, such as knocking on a patient's door before entering, or pulling a curtain closed to provide privacy, demonstrate your empathy by helping make patients feel at ease. The third is patience. Do you ever need patience? I know I do every day. Patience with calls like buzzing, phones ringing, physicians requesting, and time slipping away. Patience is indeed a virtue. To retain, regain, or revitalize your tested patients, take a deep breath. Prioritize your day. Ask for help when you need it, and delegate when you can. And remember, sometimes hate makes bleed. Copability. Your ability to cope. What I call copability is extremely important to how you are perceived, how you are approached, and how you survive. Self-esteem. I am a special person. I am a nurse. I suggest that you say those simple words every day as an affirmation that the choice you made to become a nurse was one millions of other people could not possibly fathom, and one that countless people admire. Sense of humor. Maintaining a humorous approach to life and to your patients enables you to help not only yourself, but also your peers, and most profoundly and importantly, your patients. When others see you in a good mood, they also feel like they're stopping in time. If you are in a bad mood, and you are negative about what you do, and if you are negative about your profession, that's the way other people will see you and respond in kind as well. Trust. A lack of trust between you and your patient can lessen his or her desire to be honest and cooperative, but also it could hinder their eagerness to get well. Building trust can start with the simplest of acts, such as a smile or a handshake or taking a few minutes to listen. Camaraderie. Creating and maintaining a healthy environment begins with teamwork. It is much easier to ask for and provide help when everyone realizes the door stays both ways. Treating your coworkers as valued members of a team will help you meet the goals of your unit and improve patient care. Number 9, knowledge. The stream of new information that pours into our medical libraries and journals is never ending, and it's our responsibility to keep up with all these new findings. Openness to change. Change is always difficult, and I can tell you, now that I'm 36, and going, I can tell you change is always difficult. However, the day that you're no longer willing to learn something new is the day that you really should hang up your stethoscope and call it a career. Call it the end. It's time to say goodbye. In conclusion, each one of you brings a part of yourselves to the nursing profession. If we continue to build on the strengths that we have brought us thus far and incorporate just these 10 talents of nursing into your everyday routine, I think you will enjoy the rewards that nursing offers. The kinship and association to the profession provides, and the satisfaction and appreciation of a job well done. At that point, I think you can consider yourself a great nurse. Each moment of your life is a brush stroke and a painting, and I say that because I also like to do artwork. I paint. It's a brush stroke, and it is part of a growing career. I hope your life painting is a masterpiece. Thank you.